All right, well, in other health news, the New Mexico March of Dimes has launched a new program to help prevent birth defects right here in Bernalillo County. The program will educate women about the importance of taking folic acid before and during pregnancy to help grow healthier babies. Always important. Joining me this morning is Dr. Sahar Nouri with the Loveless Medical Group. Sahar, thank you for joining me.
Thank you for having me.
Appreciate you being here. Very important stuff, near and dear to my heart. I have a 2-year-old, so very important stuff. So can you first of all explain what folic acid is and how it helps prevent birth defects?
Well, folic acid is basically just a vitamin. It's vitamin B9, and it's very important in preventing birth defects, including spina bifida and any other brain anomalies, which occur during the first month of pregnancy before we even find out that we're pregnant.
Really?
So it's very important to take it.
Okay, so it's good to get on this head on.
Right.
Right, but well before. So if we're planning on having babies, we got to get on this.
I
Okay.
think even people who are not planning should just be taking this daily.
Right.
Because they find out they're pregnant before or after the
Yeah,
spinal
exactly.
cord has formed.
Exactly. Well, so of course you said spina bifida. What are some of the other common disorders that we see in babies if mothers are not taking enough folic acid?
Well, they have spina bifida, and then they have problems where parts of the brains have not formed, and then those babies tend to not be able to live once they're born.
Really?
Yes.
Wow. Okay. Well, so, you know, I'll sort of share this a little bit. My wife and I, we were planning on our little girl. We were working really hard. So we started on prenatal vitamins very, very early on.
Good.
And we were
Good.
like, all right, we're getting ahead of the game. We're going to do this. But you're saying that it may not be enough to just take a prenatal vitamin. Is that right? Or is there, I mean, should we take an additional supplement of folic acid?
Well, actually, prenatal vitamins tend to have at least the minimum amount that you need to take, which is 400 micrograms a day, and most prenatal vitamins have that. So even just a prenatal vitamin should be enough.
Okay.
There are patients who do have other risk factors and should be on a higher dose, and so that's why I think the most important thing is that patients be seen before they plan to get pregnant, so we can identify these risk factors. And
Well, what are some of those risk factors, if you don't mind me asking?
some of these risk factors are, first of all, patients who've had a baby already with a neural tube defect. They should be on a much higher dose. And then also patients who are on certain medications for seizure disorders and other medications like that can decrease their folic acid levels.
Okay. Okay, and so when we go in to do these screenings, what kind of screenings do you do to help moms know if they need to get ahead of the game and start taking more?
Well, just having them come in and just do a history and physical, just find out about their medical problems and if they have any medical problems. But otherwise, if they don't have any risk factors, then just taking a daily prenatal vitamin should be sufficient.
Okay. And if there's anything, once we find out that we're pregnant, because like you said, most moms, they don't know, right? I mean,
right.
it happens. You may be planning, but you just don't know until after you've taken the test and you realize. So if we are behind, is there anything that we can do to kind of get amped up on that? Is it taking more folic acid, or is there anything that we can do to make up for lost time, I guess is what I'm trying to ask?
Actually, no, it really needs to be taken before pregnancy occurs.
Okay.
Because the spine and the brain are develop in the first month of pregnancy. So if there's not enough folic acid at that time, then the malformation has already occurred.
Okay. Okay, great. So really the bottom line, just get on it if you're even thinking about having kids.
Right.
So of course, viewers, we can learn more about what's going on at the marchofdimes.com/New Mexico. Thank you for bringing this information. And if you're thinking about having kids, folks, get on the folic acid. Bottom line.
Bottom
Thank you
line.
so
Thank you.
much. Thank you.